Got on the computer. All right, we've just started recording. Good morning and welcome. In the meantime, I'll try to get things going. It's all good to see you again. And as always, I always introduce my talk like this. So I say good morning and welcome to all the listeners and the viewers in the Zoom platform. We'll be later be connected to the Facebook platforms. This is the show, Dr. Nhlakanipho Talks Health. We are in the 5th episode today. Last week, we spoke about the role of traditional healers in the modern society. And we invited Dr. Sangoma, who is a Sangoma, yet also trained as a medical practitioner, to talk about some of these issues and his experience working in two environments. So today, I'm inviting everyone to listen to today's talk show. We are looking at the role of managers in healthcare. As we know that any organization started has a set of measurements that quantifies its output. But for them to achieve their goals, they need to invest in something or someone, and that someone can be an employee. So the big question today is, how do we maximize our outputs in healthcare? Is the role of managers in healthcare well defined to ensure productivity? And we will be talking more about employee motivation in itself. So today I'm joined by Dr. Fredlund, my mentor, a rural physician. He tells me that he's already retired now. So he's a father, he's a husband. I know him also as a guitarist, a community member. Welcome and good morning, Doctor.
Thank you, Nhlakanipho.
Thank you so much. So today we'll be looking at the things that actually involve healthcare services in our country. We know that we are actually way behind in terms of we are chasing universal healthcare procedures and making sure that we increase the access of health to our people, mostly to people that are under privileged, people that otherwise, if government wouldn't make a plan to get them the health care that they need, would actually suffer. But most importantly, we want to give them the quality of health care more than just providing them with any care. So thank you very much for developing interest into the topic of management in healthcare. And this indeed is a very interesting topic, but I would like us to talk more about management in its broader sense. And if you can, just a little bit just to talk about yourself and where you come from and where you are and what you've done and your experience in the medical field, please.
Yeah, I don't want to talk too much about myself, but I spent 40 years at Umseleni running a district hospital in the Department of Health. And I was there as a missionary, but working for the department, working for government, well, really working for the community, but paid and sponsored by government. And I never saw myself as so much working for government as working for the community. And that I felt that that possibly was my motivation, was that, in fact, the government was supposed to work for the people, not the people for the government. And that was where we were at. I've just retired from health services because I'm 65, but I've not retired from the issue of serving people. And I'm very interested in motivating people to go on in serving people.
Yeah.
Motivation is obviously the key. And that's what we're going to talk about today, isn't it, really?
Yeah, correct, yeah.
How do we motivate? How do we get people doing what we want them to do? Yeah.
Yeah. So it's quite interesting how you actually highlight the fact that you saw yourself as somebody that works for the community rather than working for government. Why do you make that distinction?
Well, it puts a very different priority on your actions, because when you work for the people, you're looking to see how you can best serve them. When you work for the government, you're looking to see what they want you to do. And therefore you dress up what you're doing as what the political masters want.
Yeah. So do you think that perhaps if you're looking at from the point of view of what I would say versatility and freedom when it comes to doing what you think is right in the healthcare versus what is expected of you by, how health is governed. Do you think that our system actually allows us to be that versatile in our approach to providing healthcare services?
I think the system could allow us to do that. I
Yeah.
think it depends on the role players, and from time to time it has allowed it. A
Mm.
lot of development in health care happened in the old KwaZulu, in the district management systems, the clinic services, etc., were developed quite strongly with very little resources
Yeah.
by a department which had that view, I think. Although I was working I came to South Africa, there was a government of oppression, of apartheid.
Yeah.
I was not aligned with that government, so I naturally didn't feel I was serving them necessarily, but I knew I was serving the people in the area. When we got the new elected government, one had the hope that this government really was going to fulfill its rhetoric.
Yeah.
Well, you can judge that yourself. I'm not going to judge on that. But at times, management has misplaced its enthusiasm.
Yeah.
Management cannot possibly know what needs to happen to Mrs. Gumede in Umseleni.
Yeah.
They can organize guidelines, but they don't really know what treatment she needs.
Yeah.
The person who knows that is the clinician who's standing with the patient. And that's one of the problems when you have a top-down management that says, we know best, we will tell you how to do what you should do.
Yeah.
When you actually need the clinician to make the decision and be supported by a management system that provides the wherewithal to act.
Yeah. That's quite interesting because, I mean, we will talk about this a little bit at a later stage. And I got lack of being involved in management, in healthcare management at an earlier stage. And I do have my reservations in terms of how things are being done and the approach that we actually have when it comes to us being involved in that as medical practitioners in itself. But I think that it's very important to also reiterate on what you've just mentioned. And you just spoke about what I will then maybe briefly define as a bottom-up approach instead of a top-down approach that we seem to be following.
Yeah, I think that's right. And I think one of the funny things is as a department, we employ some very, very clever people. We employ the brightest of South Africa in the Department of Health. They're doctors,
Yeah.
Professors, specialists, and generalists. They all have a tremendous academic ability and understanding. And then we tell them that we know better as managers. And that's a bit silly, really, because that's shooting ourselves in the foot. Why would you, Microsoft say, why would I employ people and then tell them what to do? I employ them because they're clever enough to know what to do and to tell me what needs to be done.
Yeah. So in essence, what I'm picking up is that you're rather saying we do have people that we've employed and put them in the system. The only thing that is expected of them is to do precisely what we think should be done, but we should be able to give them the space to be able to do what they need to do.
I think it's even more than that, in Shaganipa. I think that sometimes as managers, we don't even know what they should be doing. So it goes a step beyond that because you didn't know that you could do podcasts 10 years ago.
Correct.
So if your manager had said, you must do this, they couldn't. But you've developed this and you've realized it's possible.
Yeah.
Because you've investigated for yourself. And I think as a manager, one needs to recognize that your employees can go beyond you and beyond what you know. It's not that your employee, I was a doctor and I was a manager, but I didn't think that every doctor underneath me, if you call it underneath, needed to follow my direct instructions. And that was the way to get the patients treated best.
Yeah.
It was a discussion. I would offer my input, but I would let them exert their clinical understanding. And at times they would teach me things.
Yeah.
And I would grow. I have grown for 40 years at Umseleni. I did not know most of the things I know now when I first started.
Yeah.
And I grew through the learning from the employees who worked as my subordinates, if you like that terminology.
Yeah.
Um, and I think that's where we're missing it sometimes,
Yeah.
and losing the power of what we have in our hands. I think we have a fantastic workforce.
Yeah. But
We need to.
sometimes it seems to me that sometimes we doubt that we have that fantastic workforce, and
I,
we're doubtful of the skills that we have employed.
I agree with you. I hear managers sound like they have to force their workers to work.
Hmm.
That nothing will happen unless they tell them what to do.
Yeah.
And I'm amazed because I've also seen the converse, and I've traveled around. Working at Mussolini, I've seen it firsthand, what people can achieve when given the possibilities.
Yeah.
You know, so yeah, it is interesting, and you're right. I think sometimes when things go wrong, it's particularly problematic for managers, and they then start saying, "Well, I will tell people how to do things better,"
Yeah.
and they actually create even more problems.
Yeah. So just about before, when I was preparing for this interview, I actually read on different styles of what I'll call, is it management, or different styles of leadership, and they are more classifications of leadership, but some people classify them as five leadership styles, and some people will group them into three. And one would be an autocratic type of leadership. One is more incorporative style of leadership, and perhaps maybe the other one is they just let you to be, like they sort of like leave you to do whatever that you want to do. And so what would you say in health? What type of leadership style would actually work better for health? Because we know that in terms of management, every book that we read and all of those type of things, they are actually more focusing on business management rather than healthcare management. And those are very two different actually scenarios for somebody to manage.
Yeah, it's interesting. You see, one of the things we're looking for in health is obviously capability, professionalism, but we also want warmth and we want care. We call it a caring profession. So when you turn up at a hospital, you want to know that the security guard, that the cleaner, that the nurse, that the clerk actually concerned about you as a person.
Yeah.
You don't just want to be processed as a number.
Hmm.
You want the doctor to see you as a human being, not just as an object to be poked and cut and chopped up and a disease entity. So if you want that, you've got to have a system that supports that.
Yeah.
So one, we don't want to lose the capabilities that we have. We want to motivate them. Now, you can't motivate people to be loving by being non-loving.
Hey.
You can't motivate people to be caring by being autocratic.
Yeah.
And by being aggressive. And when people fail, being punitive does not produce the type of work you're talking about. If you can't be that person to your work employee, how can you expect your employee to be that person to the community?
Sure.
So you've got to change your style. You cannot have a line that says, "You do what we tell you, or else."
Yeah.
Because then your worker will have the same attitude to the people underneath them, and the people underneath them will have the same attitude to the community.
Yeah.
And yet we proclaim that we want to support the community. So when the politician hears a complaint from the community, what they do is they abuse the worker
Yeah.
in order to try and make the worker do better. Well, that doesn't work. I mean, that's counterproductive. The
Yeah.
more you do that, the more abusive the worker becomes to the community.
Yeah.
The more abusive the manager becomes to the other manager underneath them. We have examples of that, and obviously one can't talk of the examples because that's private and confidential.
Yeah.
But in general, I have seen senior managers abuse junior managers who
Yeah.
then abuse staff underneath them, who then take it out on the person that's underneath them.
Correct.
And I've seen that repeatedly happen in the health service. At the same time, I have also seen the converse.
Hmm.
So
Sure.
I've seen when people feel cared for, giving care to others. And I think that's step number one.
Yeah.
You know, Jesus had an interesting comment. He said, if you love me, you will keep my commandments. So the keeping of commandments in Jesus' system was based on love
Yeah.
of the master. So yeah, it's not that people don't keep the rules, but you can't, if you use fear to make people keep the rules, you end up with a different outcome. Because fear generates a different type of behavior. It doesn't really motivate. Fear actually demotivates. It stops you from doing things.
Yeah.
I mean, it's aimed at stopping you from doing wrong. So it demotivates you from doing wrong. That's true. But that's all it's good for. It's not terribly good for motivating you to do right.
Yeah.
You know, love is much better at motivating you to do right.
Yeah. So,
And
so in essence, we can actually take care of somebody actually highlighted this in one of the interviews when they spoke about the role of managers and the role of supervisors. And he said the role of supervisors is to ensure that the employees are happy enough for them to be able to deliver the service that they want with joy.
absolutely, absolutely. I think that's a very good point. You know, people shouldn't come to work in fear of being at work. They should be coming to work to enjoy the delivery of what they're doing.
Yeah,
And a well-motivated worker in any industry is motivated by goes home saying, I did a good job.
sure.
You know, that's what really motivates people. And that can be in a service industry, it can be cleaning, people cleaning things. It can be people delivering healthcare to staff, patients. I know many people who go home feeling they've done well. We had a strike at the hospital, a general strike some years back, and we had community members come into the hospital to help. And there was one lady who was a widow with 5 children at home. I think she probably could just read and write. She had maybe grade 2 or grade 3 education. But she was a loving character. She came in and she went to the gynecology ward, and there was nobody serving food. They'd all on strike. So she got the food and she took it round. She found a lady who was dying of cancer. Okay, cervical cancer, advanced stage. Very miserable, very sad, and nobody looking after her. And she sat with her and she held her hand. She came back to my house in the evening and we were sitting around the table eating, and she says, I found this lady, she's very upset, and I just held her hand today.
Yeah.
And then the next day, she came back and she said, my lady smiled today.
Oh.
And 3 or 4 days later, the lady died, and she said, the lady died with a smile on her face, knowing she was cared for.
Hey.
Now, that she was very motivated by that. She was paid nothing. Nobody gave her anything for coming up to the hospital and doing that.
Yeah.
But she understood what care was.
Yeah.
And that just made it for her. And all of us around the table, it was a great experience, you know?
Yeah, that is very deep. Actually, it just reminds me of a concept and the pillars of what we define as quality in healthcare. And obviously, I mean, in quality, they say that you need to be patient-centered, you need to be practice safe, it's a safe practice, you need to be timeous, but you need to be also effective and also efficient. But one of the things that they don't actually say much is about staff satisfaction. You also need to make sure that in that quality that is being provided, the staff themselves needs to be taken good care of so that they'll be able to go an extra mile in providing that to their own patients.
I think that's right. And I think as doctors, we're often guilty of thinking you can care for the patient without caring for the nurse and the cleaner in the hospital.
Huh.
And in fact, you can't. It's arrogance. It's not care. And it's an abusive relationship. If you switch from shouting at the receptionist to, oh yes, Mrs. Jones, so sweet
Yeah.
for her, but so bitter for the other person. Now, Jesus says you can't have, James says you can't have bitter and sweet water coming out of the same fountain,
Hey.
So if you want to have a caring profession, you've got to be a caring person. You've got to practice care for your colleagues as well as the patient.
Yeah.
If you want to be effective carer to your patient. I challenge my staff to come to work with the ambition of making 2 of the other staff members happy during the day.
Yeah.
I think it's a great idea.
It is. It is. And what was the outcome of that? Did it see any change in their behavior?
I think we had a very good team of caring people who looked after each other and the patients. We got very good feedback. I mean, obviously things don't always go right.
Yeah.
People do argue with each other. Patients are sometimes mistreated, but the general feedback was good. Yeah, people appreciated what they experienced.
Great. So when we just go a little bit deeper into the issue of motivation, especially on the employee side, what would you think is the root cause analysis? I mean, what is the root cause of all of this? Why do employees find themselves in a situation where they lose motivation to be able to provide a better care? If you find like complaints, many complaints in a facility, top on the list is they tell you about stuff sort of like they're not treating patients or the community right. It's always about, staff did this, they talked to me about this way, they dismissed me, they sent me away, and all of those type of things. What would be the reason that has led us into a situation where we have that low morale in terms of, how we practice as the healthcare workers?
Yeah, I think one of the keys to what you said there was, why do they lose motivation? And I think as managers, we need to hold ourselves responsible for that. Because most people, when they start work, the vast majority, certainly at the beginning of their working career, are keen to do a good job. And that's not just met doctors. I've watched administrative staff appointed, very enthusiastic. And you know that, you see that.
Yeah.
The first month, they can't do too much for anybody. They want to get everything right.
Yeah.
The second month, they're slowing down. The third month, they're taking long tea breaks. The fourth month, they're just hiding the documents under the desk.
Yeah.
And so they are being demotivated by the work environment. And it's easier to demotivate people than to encourage their continuing motivation.
Yeah.
Whereas, most of the things that we talk about one of the things that we have a big problem with in our health department is that we have overambitious targets that actually geared for people to fail.
Yeah.
So we set them an unrealistic expectation and they fail.
Yeah.
And when they fail, we now then use fear. So when they failed, we create a fear situation and they become totally demotivated. Fear makes you not do things because you fear of failure. Do it, you can fail. If you don't do it, you can't fail. So you don't do it. You don't explore. You don't look for answers beyond what you know because you're afraid of failing. And you will fail. I have failed many times. I've made mistakes. But I've been able to go on. And I think those are the ways in which, as managers, we close the door on people very quickly. Because we have adopted a lot of very high standards in our Department of Health. And if you look at any particular protocol, any particular process, you can't fault it. You could say, yeah, that's right, that's right, that's right. Think of the EPMDS system.
Yeah.
Of scoring your employee. And you've got all these things you're supposed to look at, and it's complex.
Yeah.
And it looks like it offers you hope that they're going to give you this, 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 and this, and they will give you training, and they'll give you growth areas, and you will write a report, and they will give you bonuses, money, and all sorts of things. But in reality, if you don't fill it in properly, or if you fill it in and they lose it, they don't even give you a 1% notch progress.
Yeah.
So the fear is that you might just not get it. So you go for you go for the middle score, where you have to do the least,
Yeah.
and you do it as a task that needs to be done in order to get your notch progression. And I've found nobody has actually used it to motivate people, only to punish them for non-compliance, for getting in information, or not even non-compliance, but the failure of the human resource department to keep these documents. Then you stand in human resource, you look at the complexity of the documents which are required for an employing a person.
Yeah.
And for the processing of that person's pay and their progress and promotions. And the staff are not capable of doing those processes properly because they're not that educated.
Yeah.
But even when they're educated enough to do it, there is too much of it to do for the number of staff they have to do it.
Yeah.
They're not efficient enough to be able to carry it out. So they get demotivated by the constant fact that they're going to fail what they're being handed in front of them. So instead of doing more, they do less.
Yeah.
So it's like the teachers I used to see in the schools who do very little, but they claim their class is massive. They've got 50 students and they have to work terribly hard. So instead, they just don't go to school. They sit in the classroom. They sit in the staff room and they talk to the other staff instead of going to the class. I mean, you've experienced that, been there. You've seen many teachers who have already given up on teaching and they're just drawing a salary.
Yeah.
Because they feel they can't succeed.
Yeah. That's quite interesting.
There's nothing like make a situation that is incompatible with success, you will demotivate people.
Sure.
You have to make the task succeedable so that the output can be rewarding.
Yeah. And isn't the output, when you achieve, the set goal that you have, also rewarding in itself? When you feel
Absolutely.
like, this is the plan, that I had and I want to achieve 1, 2, and 3. And then when you get it right, it gives that fulfillment and that joy and that motivation for you to continue to do good.
Yeah, absolutely. I think that's why people like to know how big their task is.
Yeah.
And there are a few people who like to have an open-ended event that they can go forever.
Yeah.
But many people like there's a boundary that they can see as reachable, and then there's an extra performance which they could possibly get to.
Yeah.
And they like to be encouraged by the fact that they're achieving it, they're moving towards it, they can see it.
Yeah.
But what we least need is yet another system of monitoring it. What we need is the humanity in the managers to understand people.
Sure. So here we come back again, and I'm bringing this thing. And in my previous podcast, I actually tried my level best to go through what I would call a contemporary management or executive management in a facility. And obviously, I mentioned that there were different types of managers that exist in them. You've got a CEO, a senior medical manager, you've got a systems manager, you've got a finance manager, you've got maybe a deputy nursing manager, and also maybe M&E and PRO, and all of those people. We think that those people are actually given a task and a responsibility to be able to make the job for the people that are actually delivering the healthcare services much more easier. Do you think we are open enough to be engaged by our own employees as managers? And if we are, how much of what the employees say do we actually take and actually start take their own innovative ideas and put them into implementation?
Well, I wonder, because I think I'm seeing that, in fact, the managers at the institutional level are being closed down much more by the regions and by the province, and that themselves are not allowed to make decisions or even have inputs. I went to, more recently, just before I retired and before I stepped out of management, I went to a management meeting as the acting CEO set up by the province. And they had a big discussion about why things were not going well. And the CEOs wanted to say one thing, but the province said, no, the outcome of this meeting is this. And we said, no, it's not. We don't agree with you. They said, no, this is the outcome we are recording.
Yeah.
They had pre-decided what they wanted to hear, and they
Yeah.
were not prepared to hear even their CEOs' comments about how things were, because they had decided what things should be.
Yeah.
And that attitude then filters down. So you've got to reverse that process, and you've got to be able to. Have we got those managers who are courageous enough to stand up to those bullies and say, look, guys, you don't even know the first thing about how to manage people when you talk like this in this context. You have a militaristic approach to how you care for people. It doesn't work.
Yeah.
There are situations where a military approach is appropriate when the bullets are flying and we're in emergency and you've got to get something done quickly. People have got to trust the person who's leading sufficient to follow an order that they don't understand. That's
Yeah.
true. But that isn't everyday life.
Yeah.
And so, yeah, I'm not sure that. I think many managers feel very vulnerable to the bosses above them.
Okay.
I think it was highlighted to me when I was talking with a previous head of department who said to me, Victor, we are all vulnerable. And I
Yeah.
said to him, that is so sad, because that's not where we should be.
Yeah.
We should all be accountable, but not vulnerable.
So in essence, this is the psychology of the industry, where when I feel pressure, then the person below me feels pressure, and then that person also will make more pressure to the person below them.
I was blamed by the MEC, a previous MEC, for protecting my staff too much. But our hospital won the Bato Pili National Award for the best government institution in the country.
Yeah.
In 2015. So protecting your staff is not a bad thing, actually.
Yeah. That's what motivates them, because they know that there's somebody up there who actually cares about them. So in a way, then they will do their jobs diligently.
Yeah.
That's quite interesting. There's an issue actually that we are facing as the health industry, and this seems to be standardized throughout in South Africa, but also into some other parts of the world. And that is an increase in the number of litigations that come to health, and it is haunting us because it is taking much of our budget, and the budget that we haven't really budgeted for to be able to take out that large amount of money. And this normally is actually linked to patient safety incidents and what we do and what happens. Now, are you safe, or rather, are you happy with the process of investigation and engaging of employees when something wrong has happened in the facility? Previously, you mentioned to say that when something goes wrong, the first thing that we do is to go and want to hold an employee accountable. Are you happy with that process, where the process of trust to the employee that is alleged to have done something wrong, having to engage them and to really find out exactly what had happened so that we'll be able to solve these issues?
You see, many years ago, health recognized that the problem of punishment and the problem of retribution in health was actually holding development back. And we launched what was called ran perinatal mortality meetings, confidential information, because we recognized that the blame approach does not improve the quality of output.
Yeah.
So why did we have those confidential inquiries? Because we wanted not to hold a situation guilty and then crucify them, but rather to raise the standard.
Yeah.
The problem with the attitude that says, if you do something wrong, we stop you, we crucify you, is you actually would have no doctors in the society. If every doctor who ever made a mistake was immediately stopped from practicing medicine, you wouldn't even get past year one of internship.
Yeah.
And society fails to understand that. we have set ourselves up in society as if we are gods, and we become very intolerant
Yeah.
of failure. But it is normal for human beings not to get 100%.
Correct.
I can only think of maybe one or two exams where I got 100%, you know, and, that was probably a bit of luck, you
Yeah.
know. You can do well, but you do well when you get 75.
Yeah.
So how can you then constantly, say if a mistake happens with serious consequences, then that's the end of your career. That's the end of you. We don't want you. So when we see a problem occurring, what we should actually be doing is saying, let's look back at the system and how does it support the person to make the right decisions?
Yeah.
Not who's guilty.
Yeah.
And that's the wrong answer. Who's guilty is the wrong question, so you will get the wrong answer.
Correct.
What you need to know is how can the system support better decisions to make sure that these problems don't recur.
Yeah. That's
But
that's a very important statement that you're just making right there, to say how can we improve the processes to ensure that
yeah,
at least we decrease the chances that something will go wrong. Because in essence, we now
absolutely.
realize that to err is human. The fact that you are a human
Yeah,
being, you will make mistake.
yeah, yeah. And we have to accept that we will make mistakes. And in fact, I'm going to be talking about mistakes on Monday. I'm talking on another seminar for UCT about making mistakes. It has been said that, a person who makes no mistakes makes nothing.
Yeah,
You
that's
know,
very true.
we make mistakes. We are human. The only one who's totally doesn't make mistake, that's God.
Yeah,
You remember the story of the talents? Jesus told a parable. He said there were guys given 10 talents, a guy was given 5, and one was given 1.
yeah,
And the guy who was given 1 refused to make a mistake. His answer to the Lord, when the Lord came back and said, "What did you do with my talent?" He said, "I knew you were demanding, and I was afraid. So I hid the talent. And
yeah,
here it is. I haven't made any mistakes, God.
sure.
I've made no mistakes. The talent is still here. I was afraid of mistakes. That's what happens."
Sure. But that's a
But he
very
didn't get
interesting
praised.
narrative.
He didn't get praised. He got blamed.
Yeah. That's a very, very, very interesting narrative, because that's so what I'm actually thinking is that our population, our communities have been conditioned to think that healthcare workers or hospitals are not supposed to make mistakes and
Mm.
are not allowed to make mistakes. Let me use that term, that you're not allowed to make mistakes. And because obviously, I think there is a particular reason why people think that when they come to the hospital, they should expect 100% that they need. Is because we also are dealing with a human life, and our mistake might cause death. And perhaps maybe this is the reason why they feel the way they feel. What do you say about that?
Yeah, it's interesting, isn't it? But I think actually we misunderstand the community, because I think the community does know that people make mistakes because they make mistakes themselves. And us saying that we don't make mistakes, actually, they just say, we know better. I mean, there is no day when there is not a mistake made, even in the best hospital.
Yeah,
And what the community is responding to is the feeling that nobody cares about the mistake. Nobody cares about the patient.
yeah,
It has been shown very clearly that patients do not sue, even when a mistake happens, in a litigious system, when they know the carer cares.
yeah,
And what they're responding to is the feeling that, nobody cares about me, so I'm going to punish them.
yeah,
And I think we would be much better off if we concentrated on giving the care, rather than trying to punish people
yeah,
and telling them that we've got a perfect system. When I've apologized to people for things that have gone wrong, they've been forgiving, generally speaking.
yeah,
I mean, obviously, it does make you vulnerable. And in the situation where we have lawyers looking for fees, it is quite dangerous.
correct.
And And I think they do feed that program. But we as a society have put that up there, and we promoted it as being clever, as
Yeah.
being good. And I think we need to rectify that as well. And we need to say we need to have a tolerant society.
Yeah.
A tolerant society is one that tolerates the fact that people make mistakes
Correct.
and they say sorry.
Because I mean, most of the people actually want that. They want to know what happened, how did it happen, and then they want to say, "We are sorry. We are going to make things better next time.
But they
We will
want
do
to be able
much
to
better."
live, but they want to be able to live next door to you quite happily, don't they?
Yeah.
So they don't really, I mean, they don't want to be the bad neighbor either.
Exactly.
They don't want to, they don't want to see you die of poverty because you made a mistake. So yeah, we need to understand people and make a better caring community.
Great. So I've got one comment here from Dr. Tilize on Facebook. It says, one problem with most of our managers, they think that they are bosses instead of being the leaders. When you go talk to them with regards to things that you don't like and you come up with some sort of better strategy, you as the one on the floor get to be misunderstood. And I always feel like the managers think you are complaining because you don't want to work. How true is this?
I think there's a mixture. I think because of the situations we talked about and the fact that people don't feel free to make different local variations and things like that, they can feel trapped. The manager can feel criticized. I mean, sometimes when people come with an idea, you feel they're criticizing what you've set in place. And I know that experience myself.
Yeah.
Not every good idea in the idea of the employee is a good idea. There are reasons why it may not be a good idea.
Yeah.
But it should be tested. I tried to set up a project in our hospital. I called it 500 Minds. I said, you know, managers, there are only 5 managers. We can't possibly see all the things that need to happen in the institution.
Yeah.
Even if we're the cleverest in the institution, we've only got 5 minds.
Yeah.
But what about the rest of you? 500 minds. If you all apply them to the work, couldn't we make this better?
Yeah.
And I asked people to actually come with their ideas and bring what they saw. And let's see if we can't improve our systems, if we can't make your workplace more effective, more pleasant, more enjoyable, more efficient. And I think good managers open up to ideas and they say, yes, bring ideas. I won't accept every idea.
Yeah.
I will examine every idea.
Yeah.
I will discuss with you the idea. And I said to my staff, and one day I was in OPD and one of the staff just commented on my leaving party recently. They said it struck them. They were a student at the time, I think. And they were commenting about, oh no, it's somebody who's a GP trainee. They're in the UK now, but they put it on a video and they said they were in the OPD and they were having a problem with something. And they said, this system doesn't work. And I was standing there and I said to them, well, if it isn't working, let's change it. How do you think it should change? And they said that's the first time they'd heard a manager say anything like that to them. And they worked in the British NHS and they worked in South Africa and they'd never heard that.
Yeah.
But that's the truth. Systems are set up to help us achieve our goal. If the system isn't working, we can change it.
Exactly.
So let's make it do what we want it to do. That's the sensible management position. I agree with you. There are managers who are closed books and they're not prepared to hear.
Yeah.
It's true. But it's also about approach. So you can also win over the manager by approaching them the right way or drive them the opposite direction by approaching them the wrong way. You know, it's not nearly always as obvious as it seems. And doctors are very clever people. So let's apply our minds to how we change our managers as well as how managers should change.
Yeah.
Because from the underneath, you can also change the people above.
Correct. You know,
they don't have to take a seminar somewhere else.
Yeah. I just want to make an example. You know, you just mentioned something that for some reason I didn't know how to, I wasn't able to sort of like give a definition of what, you know, I was saying to somebody. And I was saying that when I enter the gate of the hospital, my eyes are all over the place. It's like I'm a detective myself. Yet I know that the infrastructure and every other thing is not my responsibility per se. It is the responsibility
Yeah.
of somebody else that needs to look into that. But when I see like there's a gutter falling, or I see a stretcher lying around, or I see a broken glass or something like that, or I see something that is hazardous, or a pit or something like that inside the hospital, my thought is always, okay, this is something I need to go and report this thing so that it can be sorted out, because I see it as my responsibility, even if it's not me who's entirely responsible for doing something about that. But the fact that I'm there and I'm looking at this thing, it is actually my responsibility to report it, to make sure that it is actually fixed. Because as much as we have certain managers that have been put in place, it's very true what you've said. They cannot be everywhere.
That's right. Yeah. Yeah. So it's about the way we report it. I think there's ways of reporting, there's ways of reporting. You can win friends or you can make enemies. And so if you say, why haven't, this is a mess, this is terrible.
Yeah.
Or if you say, I've noticed that there's a problem at that gutter, do you think, just mention it to the maintenance guy, you see? It's quite different. So where it's your responsibility, obviously you have to call the person and say, have you seen? One of the things I say to new arriving staff is, I want to hear what you see.
Yeah.
Because you're coming to a new situation, you see it different from me.
Yeah.
I've got used to what I'm used to. I've got used to the flaws.
Yeah.
When you come in and you look at it and you see some things, I don't necessarily think you should think you can change it, but just write them down, note them, and then in a month's time or two, you can talk about those things.
Yeah.
When you've made an assessment. But note them down as you go, because you will also stop seeing those things as
Yeah.
the days go on.
That's
So
the powerful mind, isn't it? That it gets
new
used to that.
arrivals can bring a new perspective. And I think that's helpful
Yeah.
for quality management, is getting all eyes on board,
Exactly.
Yeah, I think we lose a lot when we don't utilize our staff, because our staff have a lot of things to tell us.
Yeah.
If you're a manager,
Yeah.
so you've got to open up. I was just thinking of the way we approach it as the employee to the manager, though. We sometimes have to be cunning. We have to use our own strategies. I remember going to a church once, and I was visiting, and I sat down, and I sat next to somebody. At the end of the service, the guy didn't say anything to me. I thought, this is crazy. And then I thought, well, I haven't said anything to him either, have I?
Yeah.
So I turned around to him and I said, hello, do you come here often? And he looked a little offended to me and he said, I'm always here. I said, oh, it's my first day. And then he suddenly, oh, and then he started talking to me, you see.
Yeah.
So I pushed the boot onto his foot, but without openly criticizing him and saying, why aren't you talking to me?
Yeah.
He realized he had to talk to me because I was a new arrival.
It's amazing that we can actually both ways play a very important part in establishing that relationship, isn't it?
Yeah. Yeah, I think so. I don't think you should give up. And I don't think you should give up on on your workplace, wherever it is. You can say it's a bad workplace, but it could be a little better because you're there.
Yeah.
And that's a good thing, good place to start, whoever you are. I think we have fantastic people in the Department of Health, and I think we could be doing an awful lot better than we are doing.
Yeah.
And we could enjoy it a lot more than we are at the same time. I don't think we have to suffer hard in order to do better. I think we have to enjoy it more to do better.
Yeah.
And that's really what I would say is I think managers need to understand that, and we need to find ways of not enjoying things that are not work, but enjoying work.
Yeah.
And then work will be much better and will be done better.
So
enjoyment is not about diversion. It's not this, oh, we'll give them a play day. I mean, they've done that as well. We have half a day of play. That doesn't improve the quality of work one little bit.
Yeah.
It's just another distraction.
Correct.
We need to make the work more enjoyable, not the time off. It's not, yes, there are times for recreation, but work itself needs to be refreshing, enjoyable. I think a worker at the end of the day should be tired.
Yeah.
but enthusiastic.
Yeah.
And so, the end of the day should see you more enthusiastic because you've done something, and exhausted because you've done it with all your heart.
Yeah. I used to blame myself sometimes to say, when I go to work and I feel like I've been very useless in a day, and I ask myself, what did I do today? And then I say, wow, I've been useless today. I didn't do anything today. And I feel like some form of guilt inside me to think that I could have done something, but yet when I look at the whole 8 hours that I've been at work, I actually didn't do anything that I think is very influential and beneficial to anybody.
Mm.
So
Yeah.
many people actually talk about uh, management, managers versus leaders. And these
Mm.
terms, people use them in different contexts and in different situations. And then whenever something goes wrong and they say it's lack of leadership, when something goes wrong there and there, it's lack of this and lack of that. Is there a distinction between the two, between the leadership role and the management role?
Um, Partly, yes. It's very hard to totally separate the two, but in essence, managers are people who control a process and help things to go forward. Leader is a person who says which direction we go.
Yeah.
So a good manager can lead you down a bad path, managing the path very well and getting you to the wrong destination.
Whew.
A good leader will bring you to the right destination.
Sure. So in essence, as a manager of a
We need
facility,
both.
you also need to be a leader to also be able to show the direction and where we're supposed to go.
I think so. I think so. Yes, definitely. Yeah.
Yeah, that's a very important important statement right there, because obviously many people actually talk about these things, but we really do not understand, and then we don't normally conceptualize these things. It's just the common terms that we use when things are going wrong, and really we don't know what it actually means for us to be able to embrace those qualities of leadership and our leadership styles and what we need to do, and also to read through the process and actually to guide people towards the right direction. And I think that that is what is going to get us to the promised land.
Mm. Yeah.
So I mean, we've taken much of your time. I think we've covered quite a lot of things when it comes to management and the role of management and what demotivates people. If you were to sum it up in terms of where we come from and what seems to be causing the problem and how should we actually deal with the stuff that is demotivated, how would you just give a summary of that?
Yeah. I think that's. Yeah. I mean, I think being a caring profession means we need to be caring people. I think that's first and foremost, and it should be a priority number one to be caring people.
Yeah.
And we start from that premise. And if we understand that mission, we can then build a system that works for the people that we're working with and for. And we need to set a system that tolerates underperformance but improves performance. So it tolerates the person with the purpose of improving the quality.
Yeah.
It examines the systems and simplifies them. I think systems are too complex in the Department of Health for the state of where we are at.
Yeah.
And I think we need to simplify and make doable
Yeah.
what we're doing. And yeah, we need to walk humbly. I think we need to tell people that we are not perfect. We are learning,
Yeah.
always learning. That's why we're only practicing doctors, not
Exactly.
perfected doctors. Um, but we need to be a listening group, and I think that's what I would say. I think the more you shout at a problem, the bigger the problem gets.
Yeah.
And I think we have a lot of shouting going on at the moment, aggregate aggressive behavior. We will deal with X, Y, Z because things have gone wrong.
Yeah.
And I think we need to move over beyond that. We need truth, but we also need reconciliation.
Correct.
We need truth, but we also need reconstruction of formats of thinking. And we need to give much more freedom to use one's training to the person at the coal face. Yeah.
Yeah. Well, thank you very much. You've just summed it up very, very well. And obviously, today we were going to cover, things around motivation, the leadership management, the role of management in healthcare. But obviously, I think we are in the midst of COVID-19 pandemic at the moment, and we cannot close without talking about some of those issues. At the moment, people are struggling. There has been not a rollout, but really a trial of a vaccine to healthcare workers. And we've just been told that, that process has been halted because of, suggestions of some really serious side effects in 6 people that have been found in the United States. What is your view about that? And what can we say to the public that are really concerned about the decision that has been taken?
Yeah, look, these decisions are quite difficult, aren't they? And ultimately, we need to move forward with immunization against a disease which is much more dangerous than the immunization is, even if you take it, even if those were totally caused by the immunization, which they may not have been, of course.
Yeah.
Every medicine has complications, but it's always a balance of risk benefit. And I think ultimately, if there are no alternatives, then the risk benefit is still in favor of immunizing.
Yeah.
If you have an alternative immunization which is safer, then by all means go for it. I think the big issue at the moment is coverage is king.
Yeah.
You've got to cover as many people as possible, as quick as possible, to get as much benefit as possible out of the system. And keep safe. I think, crowded indoor situations are bad, but outdoor situations are good.
Yeah.
So meet outdoors, spend time outdoors, open up the world. Classes under the tree used to be a sign of poverty. I think they're going to be a sign in the future of affluence and progressive thinking.
Yeah.
And we'll all be studying under the tree
Yeah.
because the weather's good in South Africa. And most of the time you can study under the tree, actually. You just got to improve your voice casting.
Yeah. So now we will be converting that sign of poverty into liberalism, isn't it?
Absolutely. Yeah.
Great. Thank you so much. Ngiyabonga kakhulu ngesikhathi sakho nje osithathile ukukhuluma nathi namhlanje. I think for me bekubaluleke kakhulu ukuthi sibe ne conversation efana nale because I know you from a long time ago since I was a kid, and I've looked up to all the things that you've done, and I would be lying to say that I'm grown up and I'm the person that I am without always making a reference ukuthi uyamazi Dr Fredlund usemseleni, this is izinto that akade ezenza kanje kanje kanje. And I always thought that you had done amazing things laphayana in the community. And at some point I saw you in one of your colleagues' funeral, and you were in there diving in your shorts and actually uhambe yokumhlabathi umba lapha phansi. And I thought to myself, I mean, what level of maturity do I need to get to the level where the whole community leader and somebody that is respected in the community can do something so humane that has got so significance? And those type of things really zihlalile kumina engqondweni as time goes, and I think they have shaped me to become indoda engcono for myself and also my family to actually do good things. So I would like to appreciate you very much, and everything that you've done in our community and for health in itself as well. I made a remark earlier on to say that you are this type of a person that I say you are a true family physician. One day you are a surgeon and the other day you are an orthopod and you are busy doing hip replacement and at the level of a district hospital. For me, that is uncomparable. So I would like to really appreciate you and to say thank you very much for availing yourself in today's podcast.
Okay, God bless. Bye-bye.